The piriformis muscle is a small muscle located in the buttock. There are mainly two types of pain that originate from the piriformis. In 85% of people, the sciatic nerve passes below the muscle, and in about 10%, some fibers pass above and others below. But the problem is, in 5% of people, the sciatic nerve goes through the piriformis muscle. In these 5% of people, when the piriformis is contracted or in spasm, it squeezes the sciatic nerve and causes a referred pain down the thigh and leg. The second type of piriformis problem is when it has myofascial trigger points. This is common in people who sit too long or compress the nerve by something they use in their pockets, like a wallet. The pain from trigger points may radiate to the sacroiliac joint area and to the lateral thigh. So, let's talk about piriformis muscle pain today. Before I continue, let me remind you that this video is not intended to replace medical advice. It's for educational purposes only. You should contact your doctor for a proper diagnosis and treatment plan for you. In case of emergency, go to the nearest emergency department or call an ambulance. In 1938, two anatomists, Beaton and Anson, described the variations of the sciatic nerve in relation to the piriformis muscle. They looked at cadavers and found that the majority had this distribution, where all fibers of the nerve pass below the muscle. But in 5%, the fibers go through the nerve, and in 10%, one portion of the nerve goes above and the other one below. When the sciatic nerve is compressed, it may cause sensations of numbness, tingling, and pins and needles in the thighs and legs and feet, and also weakness of the muscles of the thigh, leg, and ankle. But more common than compression of the sciatic nerve, the piriformis may develop trigger points, and this will cause radiating pain to the pelvis, sacrum, and hip. The function of the piriformis muscle is to work with the other 5 short muscles inside the buttock and pelvis, and together they do the external rotation of the thigh. This is a very important function, especially when we stand on one leg, like when we walk. Many patients think they have an injury to the hamstrings or adductor muscles because the pain from the piriformis is deep and resembles a growing strain. Another sign is that they lose the flexibility to rotate the hip. And another common sign is pain and tenderness in the area of the ischial tuberosity, which is aggravated in prolonged sitting. Many athletic and sports activity that involves sudden twisting may aggravate trigger points in the piriformis muscle. And driving a car or a truck for prolonged periods may also aggravate piriformis trigger points because the hip is bent, and to keep the foot on the gas pedal, the driver needs to maintain an external rotation of the hip. Some conditions that can perpetuate piriformis trigger points include chronic infections like chronic pelvic inflammatory disease, sacroiliitis, hip joint arthritis, and post-total hip arthroplasty. How do we treat piriformis pain? First, it is important to eliminate any factor that perpetuates the problem. Second, it is important to modify the sitting and sleeping positions. When sitting or sleeping, the knees should be kept in alignment with the hips and shoulders. When sitting, they should try to move as much as possible. This is very important for drivers and long-haul truck drivers. Check my other video about sleep positions. I show how you can add pillows to the knees and keep the hips in a neutral position. If activities that involve standing on one leg provoke pain, the person needs to train how to stretch the muscle to avoid a relapse. Stretching is best done with the person lying down on a flat and firm mat. So now we're going to stretch specifically the piriformis muscle. So this leg straight and this knee on the top of the other one, and we're going to pull the knee to this side. And you're feeling stretching the piriformis is this muscle here. And now you do for the other side. This one straight and this one here. And you pull and you feel stretching. The piriformis is a tiny muscle here, but it's very important, and sometimes it's tight and can cause pain that goes down your leg. So you repeat this many times for each side. There is another way to stretch the piriformis, which is by sitting in a chair. This is figure 4. So this muscle, to stretch this muscle, I recommend that you sit, you cross the leg. If you don't have any problem in the hip or knee, you'll be able to do this position. And then you go forward, lean forward, keep going, down, down, down. When you reach the maximum position, take a deep breath, count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take another deep breath and go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take another deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back slowly. But if the person also has low back pain, this exercise may aggravate their pain. So I recommend the position of lying down flat on the mat. Self-massage with a tennis ball or a self-release tool is recommended. But it is important not to apply pressure on the sciatic nerve itself. Another way to self-massage is using a foam roller. Watch my other video to learn more about it. And last, when sitting in a chair, try to do movements of internal and external rotation with both hips. This alleviates the tension and avoids spasms in the piriformis muscle. Well, use the share button here to send this video to any person that might have piriformis pain. And don't forget to give the thumbs up here and to subscribe to this channel. Thank you for watching. Goodbye.